Before turning to today's numbers, I also want to mention an update that we are making to the retrospective hospitalization data that is available online. When the website is updated today, there will be a decline in the hospitalization numbers for May and June. We have committed to always being transparent, so let me explain why. When the outbreak occurred at the Misericordia Community Hospital last month, an error in the system code used for our online statistics meant that patients who caught COVID in the hospital were being retrospectively counted in our hospitalized case data. Most of these patients were first admitted weeks or even months before the outbreak. Yet they were counted as hospitalized with COVID from the day that they first entered the Misericordia, not the day they were diagnosed with the virus. This led to an increase in our retrospective totals, which I know some Albertans have been wondering about. Thanks to the hard work of our surveillance team, this issue has now been fixed. Obviously, any decrease in hospitalizations is a good thing. This error had little impact on our current hospitalization counts that we have been reporting daily and did not affect any of the COVID-19 policy decisions that we have made. Turning to today's numbers, currently, 50 people are in hospital, including 13 in intensive care. We identified 121 new cases in the last 24 hours. There are now 1,040 active cases in the province. This is a reminder that COVID-19 continues to be with us, and we cannot turn our backs on this virus. Tragically, I am reporting one additional death today at the Good Samaritan Southgate Care Centre. This death occurred yesterday and was reported earlier on their website. My heartfelt condolences go out to everyone who has lost a loved one to COVID-19 or any other cause during this pandemic. The lab has completed more than 8,000 tests in the last 24 hours and more than 785,000 tests overall. I saved the testing data for last because that will be the focus for my update today. Testing is a powerful tool that helps us limit the spread of COVID-19 and protect people from infection. 1 in 7 Albertans have now been tested at least once, and that is a significant accomplishment for our province. Our labs have come a long way since COVID-19 was first diagnosed in Alberta. We have consistently had the most open testing approach in Canada. Our labs have conducted more than 316,000 asymptomatic surveillance tests. These are tests on people who had no symptoms and were not part of an outbreak or a close contact of someone who had COVID-19. Of these 316,000 tests completed so far, just 0.1% have come back positive, meaning that 99.9% of asymptomatic tests on those who had no known exposure have come back negative. This is encouraging. This testing shows that broad asymptomatic testing is not primarily useful in identifying a significant number of new cases. However, it can help us track the spread of the virus in Alberta, which aids our public health response. We are now about 3 weeks away from schools reopening. I know that many parents and school staff have questions about whether or not they should be tested. Today, I want to provide some advice. In addition to the most critical testing of anyone with symptoms, I am recommending that all teachers and school-based staff, even without symptoms, should get tested once before school begins in September and regularly throughout the year. This is entirely voluntary. However, asymptomatic testing of staff in school settings will help us with a baseline understanding for school re-entry, and ultimately help us even more closely monitor the virus in the coming year. My recommendation today comes with a caveat. There are about 90,000 school staff and teachers across Alberta. Our testing capacity has expanded greatly, but no province in Canada can collect and process that many tests all at once. I am asking teachers and educational staff to arrange testing proactively. Do not wait until the day before you are set to return to school. More information will be shared via your superintendents in the coming days. I am also asking other Albertans who feel completely well and who have no known exposure to COVID-19 to delay their testing until after September 1st. This will help ensure the system has capacity so that all school staff can access this voluntary testing before the school year starts. To be clear, if you have any symptoms, no matter your occupation, you can and should still get tested. If you have no symptoms, but you were a close contact of a case of COVID or part of an outbreak, you can and should still get tested. If you feel completely well and have not been in contact with a confirmed case, we are just asking you to consider waiting until after September 1st to book a test. Parents can continue to access testing for their children whenever they want. However, I am only recommending that children be tested if they have symptoms or pre-existing medical conditions that have symptoms similar to COVID-19. This is because in students, our priority is to make testing available to all those with ongoing mild symptoms that may mimic COVID-19, such as allergies. Parents should book all such tests through Alberta Health Services. Do not go to your local participating pharmacy, as these tests are for those who have no symptoms and no exposure. Having a test done before school to ensure these unchanged symptoms are not a sign of COVID-19 helps as a baseline for parents to monitor from as their children go back to school. In addition, all parents should monitor children for new symptoms. This is part of the daily routine that all of us parents must start getting used to. If children experience new symptoms at any time, then testing is the right choice and available through AHS. I know that testing wait times have been a concern, and we are expanding public testing capacity to help meet this demand. What we know from looking at experiences of other countries around the world and with respect to their school reopening processes and plans is that there's no one right way that's going to work in all settings for reopening schools. When my team and I were working with the Department of Education to make recommendations around school reopening, we were looking at the overall health of kids and the things that kids need to be healthy, including limiting the possibility that COVID would spread in a school, but also the benefits that kids get when they're able to be in school. We did not recommend a maximum cap or maximum class size, but rather made recommendations around maximizing physical distancing wherever possible and using additional measures such as cohorting students, the regular daily symptom checks and screening, the enhanced hand washing, and more recently masking when students are outside their cohorts, outside their classrooms, in the hallways, or undertaking classroom activities where they're not sitting still and maximally distanced. And so, again, the recommendations were based on looking at other jurisdictions that have been able to successfully open schools with varying levels of class sizes, and also the really important piece that is the key in almost every example is that when we're able to keep our community transmission at a low level, that is one of the most important things for a successful school reentry. And so it's really that community transmission at a low level that's going to help facilitate our school reentry being successful. And so I will repeat my plea from my past several weeks of updates that the more that we can do collectively to reduce our rates, the better positioned we'll be for successful school reentry.